Hi, I'm Sarah Bruce and welcome to EHI TV. Joining me now is one of our speakers, Kate Grimes, who's the Chief Executive of Kingston Hospital's NHS Foundation Trust and one of the only Chief Executives who's taken 3 hospitals through a national IT deployment. Welcome, Kate.
Thank you.
So first of all, you went live with Cerner at Kingston a year ago this month. How's it all going and what kind of functionality have you got from the system so far?
We've really changed all our IT systems across to the new system. So we've got the PAS, and that's integrated with A&E, and with maternity we've got theatres, we've got order communications electronically, we've got real-time admission, discharge and transfer, and a new data warehouse. So we've really changed all of our IT systems now to the new system. And you asked how it was going.
Yeah.
It's going really very well, actually. It's settled down. Most staff are used to using it now. There's there's more improvements we want to make, in particular to improve our data quality. But it's functioning really well, and the staff are really used to using it now.
But one of the things you mentioned in your session was that the system's actually it's quite easy to make mistakes on.
Yes.
Can you give us a bit more information about that, and is that something that you're probably trying to resolve?
Yes, I mean, we're working actually very hard to put a lot of fixes in to make it less easy to make mistakes. So at the moment, if staff don't fill in a field, it allows them to go to the next page without that field filled in, or they can put a range of different things in, and what that does is it gives us a problem with our data quality. So particularly in maternity, where the midwives need to put a whole load of clinical data in every time they deliver a baby, we are really struggling to get the kind of accurate data that we need out of the system at the end. And we're having to put work in to clean up the data at the back end at the same time as working to retrain the midwives to be putting the data in correctly, and working with Cerner to harden the system so it's less easy for them to make mistakes, and that it draws more data from, once you put it in once, it draws it into the fields rather than having to put it in again.
And I know at the start you had some issues around data migration and compliance with Choose and Book. Is that all resolved or ongoing?
Yes, the data migration systems were resolved really very quickly. We had issues where a clinic may have been full, but it showed as empty on Choose and Book. So we then found the GPs all booked into it very quickly. And so we had some double book clinics. And the benefit for that was it showed to me that actually there's more demand out there that we're not meeting with our existing services. That showed me an opportunity, really.
And again, during your speech, you were talking more about returning to business as usual, as opposed to actually seeing real benefits so early on in going live. Is that the case? Have you seen any key benefits yet?
That was really more about how you talk to the staff. There were immediate benefits. Moving from a paper-based order communication system to an electronic one immediately gives your clinicians some really strong benefits, because they're able to order electronically and get the results back much more quickly, and they come back to a central place that their clinician nominates. So that's an immediate benefit. In A&E, I remember going in the weekend we went live, and I went to A&E, and they had an electronic whiteboard that they were using. And then I went to the Medical Assessment Centre, and they said, we'd really like a whiteboard like they've got in A&E. That would make such a difference. At the moment, they have to write it down on a whiteboard with a pen. And I loved that, because that was staff immediately seeing something they could do and make better with the system, and on the first day. I had also on the first day, I went to A&E, a doctor said to me how great it was, because he'd wanted to look something up, some evidence up, and he was able to immediately flick to a page which gave him all of that evidence on the system. So because I didn't talk about benefits, but the staff talked about the benefits back to me.
You sound like you're actually doing a lot of work on the ground for a chief executive, and you're actually quite heavily involved in IT. Do you think that's been really beneficial to the success of the deployment?
I don't think that you can do a deployment of this scale without being personally involved as a chief executive. I think that if you see a deployment as a change programme, then the leadership, the visible leadership of the chief exec is really important. And really, that's how I see IT deployments as making changes to the benefit of patients.
And you've obviously come from a background where you've seen 2 other deployments under the National Programme for IT.
Yes.
How have they differed? I know you spoke about that quite a bit in your session, but
Yeah.
if you could just break it down, how has it changed and what have you learned?
Well, the first one, I guess most of the work had been done before I arrived, because we went live almost as soon as I arrived. And so what I saw there was the end product of not seeing as a change programme and not managing it well. And so that was a really visceral thing for me, just arriving as a new chief exec and finding my organisation in distress because of a new IT system, and seeing that it hit just about every bit of the running of a hospital, which was a complete shock for me. Having worked in hospitals for 20 years, I didn't realise quite how much of the running of a hospital is driven by your IT systems. And so I think for me, then I had the opportunity twice more to put that learning into practice and to do it better. And I've enjoyed that, I guess.
And so what are the kind of next steps for Kingston? In your session you talked about working with other Cerner sites, in particular St George's.
Yeah.
Can you tell us a bit more about that?
Yeah. I guess there's two next steps. So one is how do we get the benefits from our existing system, and then how do we, as we put new code in, how do we drive further benefits, and where do we want to grow the system and the efficiencies it can deliver internally. And then secondly, there are benefits from looking at how you might work with other organisations. And I think as we move into an era where there is less money around, we need to look at how we can work with others more efficiently. And St George's Hospital, just up the road from us, has also deployed the Cerner system. And so that gives us opportunity to say, how might we drive efficiencies by working together more closely? Whether that's through saying how might we unify our pathology systems, and that will avoid test duplication as patients move between the 2 organisations, or whether that's about saying let's work together around a particular service. So lots of opportunities. And also the new model for Cerner deployment and running a Cerner system means you need to invest. We need to create our own developers and our own testers. And I think if we can do that with others and share those expensive resources, that will also create efficiencies. So otherwise it's very expensive to run your own development team and your own testing team and a range of trainers you need for that. And if we do it with others, then we don't need to all reinvent the wheel, and there are ways of creating efficiencies, I think.
So you talk about sharing with others, but as we all know, the national programme was scaled back earlier this year, and one of the things that was scaled back was the Cerner deployments in London. It's going to be deployed to far fewer trusts than originally anticipated. Are you disappointed by that, now that you're getting to the stage where sharing among other Cerner systems is really coming together?
Well, actually, I think it still hits quite a lot of the trusts in London, because we're seeing more unification of trusts across London. So I still think the majority of trusts in London will be covered by the Cerner system. And we are now creating a kind of tight group of chief executives whose organisations take Cerner, and it creates an opportunity for us to look at how we can work together, to look at how we might want to influence the development over the next few years, and how we might want to work together post 2015. So I guess it's quite a good size, actually.
Yeah. So you've taken 3 trusts through these big deployments. Plans for any more?
Well, I'm very happy. I'm very happy building on the benefits of the system we've got at the moment at Kingston at the moment. Thank you.
Great. Thanks, Kate.